Democratic House leaders are promising President Obama they will have health care reform legislation on the House floor before the August break. But while they are long on promises, they are so far short on specifics. Senior White House correspondent Major Garrett has the story.
President Obama is not an astronomer or an astrologer, but after wrapping up a meeting with House Speaker Nancy Pelosi and her lieutenants, he said the time for universal health insurance is now.
We've got to get it done this year, both in the House and in the Senate. And we don't have any excuses. The stars are aligned.
Top House Democrats promised to pass a bill by the end of July, an aggressive timetable considering how few details have emerged. No one knows what services Congress will provide or how it will pay to cover the 46 million who lack health insurance coverage now. And there's no set approach to reducing health care costs. Mr. Obama spoke only in generalities.
We are not going to rest until we've delivered the kind of health care reform that's going to bring down costs for families and improve quality, affordability, accessibility for all Americans.
Soothing words that analysts say evade the tough choices ahead.
At the end of the day, this is not about cost and access and quality. It's ultimately about power and control. Who's going to exercise the power over the health care system? Who is going to make the key decisions?
The absence of Republican participation at the White House today made it clear Mr. Obama is counting on House Democrats and their parliamentary steamroller to deliver.
And that is really cause for celebration for the American people.
When it comes to health care reform, the White House has developed a sales campaign built around private sector buy-in and cutting costs. Monday's pledge, vague though it was, from doctors, hospitals, and drug makers to trim $2 trillion in cost over 10 years fit that mold. So did yesterday's meeting with some of America's top companies on their efforts to keep employees from getting sick in the first place. The imagery of big business working so closely with the White House is designed to defang GOP critics, one of whom today tried to downplay all this industry coziness.
I don't think there's buy-in among the American people for increasing the federal government's role in providing health insurance in this country.
Analysts say when doctors and hospitals and drug makers are dealing so openly with the president and he emphasizes controlling costs as much as expanding coverage, well, the White House has the upper hand.
Right now, they're trying to sell image. They're trying to suggest that there is a broad agreement on broad goals.
So the House Democrats have pledged to pass a bill by July 31st. Who cares? Well, think about it this way. There's only about 10 weeks between then and now, and 2 weeks already set aside for a congressional recess for Memorial Day and 4th of July. That leaves 7 to 8 weeks maximum to look at legislation that would affect 1/6 of the U.S. economy, cover 46 million Americans who aren't covered now, and some critics fear there simply won't be enough time to scrutinize the details of a piece of legislation that sweeping and that detailed. Brett?